Good afternoon, everybody. Today is Tuesday, December the 15th, 2020, and I want to be updating you on COVID-19. So Canada has 47,003,352 cases. Alberta has 81,996 cases, 733 deaths. British Columbia has 42,943 cases, 647 deaths. Manitoba has 21,535 cases, 508 deaths. New Brunswick has 559 cases, 8 deaths. Newfoundland and Labrador has 359 cases, 4 deaths. Nova Scotia has 1,426 cases, 65 deaths. Ontario has 14,004,396 cases, 3,992 deaths. So these are the cases that we have in Alberta and in Canada, right? Now I'm gonna be moving on, going to talking about Alberta and their numbers. So the latest, everything you need to know about COVID-19 in Alberta on Tuesday, December 15th, 2020. Alberta to vaccinate 29,000 healthcare workers by end of the month. So the latest. Alberta's first COVID-19 vaccination will take place today in the South Calgary at 4 p.m. Premier Jason Kenney said this morning the receptionist will be a nurse. The province received 3,900 doses of Pfizer biotech vaccine on December 14th and expects to received 3,900 doses of Pfizer BioNTech vaccine on December 14th and expects to get another 25,350 doses at the start of the next week, officials say. The first vaccine will be administered to healthcare professionals in Calgary and Edmonton at approximately 4 p.m. on Tuesday. The Premier office confirmed Alberta plans to administer first dose of COVID-19 vaccine to 29,000 healthcare workers by the end of December, the province's health minister says. So this is how usually that's how they're going to be dealing with the vaccine, and that's how they're going to be distributing the vaccine. And so right today we got the vaccine, but like I said yesterday, that does not mean things are over, right? Just because we got the vaccine, that does not mean we can just do whatever we want and enjoy life the way we want and do what we want at the end of the day. Because in the end, there's consequences in the end, and there's things, right? So we need to follow the health rules, follow the health guidelines. That's what's really important, and I expect everybody to do that as much as they can. So protect your health, protect your loved ones. That's what's really important about this COVID-19. So Calgary has 7,379, up from 7,286 reported on Sunday, with 24,547 recovered. Edmonton zone has 10,194, up from 9,778, 24,458 recovered. North Zone has 1,287, down from 1,289, 4,072 recovered. South Zone has 583, up from 5,702, 3,915 recovered. Central Zone has 1,594, up from 1,589, 3,004 recovered. Unknown has 86, up from 66, 134. recovered. So these are the cases that we have in Canada, right? So that's what's really important, right? So Saskatchewan introduced a new public health rule restrictions on Monday, right? Tomorrow I'll be announcing my own restrictions about our school and our places, and it will be restrictions on technology and everything. And I will be live at 1 p.m. Mountain Time to 2 p.m. Mountain Time tomorrow. And also I will be talking about when the school will be open. Either it will be February 20th, 2021, or it will be end of June 2021. And I will make that decision live and clear at 1 o'clock p.m. Mountain Time tomorrow. So it's very important that you tune in and you watch it. Also, there will be a unit exam that will be on Friday. So for my students, make sure that you do the unit exam. You make sure it's ready and done because there will be a unit exam coming on Friday for those students. And that's what's really important that everybody make sure they come for that unit exam, or you're going to lose marks if you do not show up for the unit exam, right? This is the last week before winter break. So again, like I told to everybody, it's very important that last week you do your best to protect your health, you care about your loved ones, and do what you can, right? Just because we have a vaccine, that does not mean it's end of the world. That does not mean we can just sit around and do what we want at the end of the day. We need to do what's right. We need to protect ourselves. We need to care about our loved ones. That's what's really important about this COVID-19. And we need to learn about this COVID-19 so things don't happen again in the future. We have to learn our mistakes from this COVID, right? A lot of people didn't listen. What I learned about this COVID, like I said, is my health, how important my health is, how important things are. That's what I learned about this COVID vaccine and this COVID-19. So we need to do what we can in the end of the day by protecting ourselves, by doing what's right and stepping up. That's what it needs to be done this time of, especially the time of the pandemic. People need to wake up and follow the health rules and do what's right because a lot of people out there that you see that health doesn't matter, the health is diminishing, that the health don't matter, and this is a consequence at the end. So we need to do what's right and we need to show how much responsible we are. And we need to because during the COVID-19, we showed already enough that we're not responsible, we're not big enough, and that's what it is. That's why our numbers are really high then across the country. But hopefully, in the next couple of months, now we have vaccines and we have Moderna that's going to be coming end of December. That's what the federal government announced today. Hopefully, that will change people and hopefully that will make the numbers go down. And I hope that happens, right? Because this will take time, the vaccine to kick in and to change the numbers and making the numbers the way they usually are and to make them lower than the numbers that we see today that are higher. So this will take time and I encourage everybody to do what they can and protect their health. And I hope everybody have a great day.